I am Dr. Parvez, and today we are going to discuss about physiology of larynx. Now we have three important functions of larynx, and you know that um, uh, three important functions. The larynx serves three important functions in humans. In order of functional priority, they are protective, respiratory, and phonatory. Protective, respiratory, phonatory are three primary functions of larynx. In humans, the protective and respiratory functions are compromised in favor of its phonatory function. The protective function is entirely reflexive and involuntary, whereas the respiratory and phonatory functions are initiated voluntarily but regulated involuntarily. Laryngeal function may be best understood by an appreciation of its origin determined by primitive needs. On an evolutionary scale, as animals migrated from an aquatic to a terrestrial existence, a major change in the respiratory requirement became necessary. These accomplishments were reflected in certain contemporary species of fish that develop unique respiratory modifications to allow intermittent sojourn on dry land. These structures, however, contained no values to prevent the entrance of water when an adequate existence was resumed. Structure and function of larynx viewed phylogenetically. The climbing perch possessed a respiratory diverticulum located above its gills. The most primitive larynx may be found in bichir lungfish. The larynx of this fish consists simply of a muscular sphincter to guard against the entrance of water. The African lungfish and Australian lungfish both possess, in addition to sphincteric musculature, discrete muscle fibers that effectively draw the valvular organs apart to produce high active dilatation. We can see in this figure respiratory diverticulum, and this is the digestive tract climbing perch. Bichir lungfish, this is the bichir lungfish. This is African lungfish C, and D is Mexican salamander. Then we have alligator, how alligator has it attached to this thing. Structure and function of larynx viewed phylogenetically. To enhance ventilatory flow requirement through the laryngeal aperture, the acquisition of lateral cartilage may be noted in certain amphibians. These lateral cartilages form bars on either side of the glottis to which the dilator muscles insert. To augment the mechanical advantage of these muscles, a cartilaginous ring giving origin to the dilator muscle can be found between the glottis and the trachea in other higher vertebrates, such as configuration is apparent among reptiles such as alligator. We can see here again respiratory diverticulum, this is the digestive tract, climbing perch, bichairfish, African lungfish, Mexican salamander, alligator. The primitive larynx therefore basically functioned as a simple sphincter to protect the lower airway from intrusion of foreign matter. In secondary function, supported by the sequential phylogenetic acquisition of the cricoarytenoid complex, centers about its role in respiration, governed by active muscular dilatation of the laryngeal aperture. The third function of the larynx phonation, best observed in mammals, appears to be a late phylogenetic acquisition. From a structural point of view, protective function of the adult human larynx is admittedly precarious by virtue of its low position in the neck. Other mammalian species are provided with a relatively high riding larynx, affording it a close approximation with structures of the posterior nasal cavities, the intranarial position of the larynx, securing a continuous airway from the nose to the bronchi, therefore decreases the risk of pulmonary contamination by swallowing matter. Nasopharyngeal relationship. The nasolaryngeal relationship. It is some interest that the human newborn exhibits similar nasopharyngeal connections by approximation of its epiglottis with posterior surface of the palate, thus ensuring against respiration by forming a continuous upper and lower airway. The observe of obligate nasal breathing is the newborn period may be related to this anatomic configuration, which is lost between 4 and 6 months postnatally. In adult humans, the characteristic flat shield-like configuration of the epiglottis serves to direct swallowing food laterally into the piriform fossa away from the midline laryngeal aperture. Elevation of the larynx towards the nasal cavity during the height of deglutition exaggerates this protective function. Aryepiglottic fold act as ramparts to the larynx, allowing food to pass on either side of the epiglottis along the gutter produced between each fold and the lateral pharyngeal wall. Primary role of supraglottic larynx adult humans lies in the protection of the lower airway. In the human larynx, the ability to perform as an effective valve depends on the unique shelf-like configuration of its superior and inferior fold bilaterally represented. The false chord, which are located superiorly, act as exit valves, preventing the escape of air from lower respiratory tract. When positioned by muscular contraction, they seal even more tightly as tracheal pressure is increased from below. On the other hand, the true chord behaves as one-way valve in the opposite direction, obstructing the ingress of air. Therefore, it is not surprising that expectorative functions of the larynx remain unimpaired in bilateral laryngeal paralysis. Cough reflex. Cough ejects mucus and foreign matter from the lungs and helps maintain patency of the pulmonary alveoli, may be voluntary but more often in response to stimulation of receptors in the larynx or lower respiratory tract. Three phases. Inspiratory larynx opens wide to permit a rapid and deep inspiration, compressive tight closure of the glottis and strong activation of expiratory muscles. Expulsive larynx opens widely and a sudden outflow of air in large in range of 6 to 10 liters per second. The larynx acts as a transducer during phonation, converting aerodynamic forces generated by lungs, diaphragm, chest, and abdomen muscles into acoustic energy. This energy transduction occurs precisely at the space between the two vocal folds. Our subglottic and supraglottic pressure also play a role in this transformation of aerodynamic energy into sound energy. The requirement of normal phonation are as follows: active respiratory support, adequate glottic pressure, normal mucosal covering of the vocal cord, adequate cord of control of vocal fold length and tension. It is generally agreed that speech results from the production of a fundamental tone produced at the larynx and is modified by resonating chambers of the upper aerodigestive tract. The intelligible speech therefore represents the combined effect of larynx, tongue, palate, and related structures of the oral vestibule. The consonants of speech can be associated with particular anatomic sites responsible for their generation, that is P and B, labials T and D or dentals, and M and N or nasals. The production of fundamental tone is due to vibration of vocal folds against each other generated by the passage of air between them. Vocal fold vibration may be passive phenomenon representing the basic of the aerodynamic theory of sound generation. Such a theory finds support in the observation that the completely paralyzed larynx is capable of producing sound as is the cadaver larynx when supraglottic pressure is forcefully increased. The aerodynamic theory of sound production or therefore replaces the neurochronaxic theory, which incorrectly advanced the notion that central generation of recurrent laryngeal nerve impulses produced cord vibration by active contraction of the thyroarytenoid muscle. Each vibration therefore represented the result of beat by beat impulses through the recurrent laryngeal nerve. Cricothyroid muscle increased fundamental frequency by tensing the vocal fold. The vocal fold is stretched, elongated, thinned, and slightly adducted to the paramedian position as the vocal fold is lowered within the larynx. These changes reduce the cross-sectional area of the vocal fold, reducing vibratory mass and increasing fundamental frequency. Vocalis muscle, on the other hand, generates the opposite effect as it loosens and thickens the vocal fold in addition as it increases glottal resistance. It contributes to vocal intensity as subglottal pressure is increased. The vocal control therefore is achieved by coordinated effort of respiratory, laryngeal and articulatory muscles, capable of producing great variations of tonal qualities characterizing the human voice. Action of transverse arytenoid adductor of vocalis ligament, can see here in this diagram. In this diagram, action of vocalis and arytenoid muscle, shortening relaxation of vocalis muscle. The glottal cycle. The vocal fold alternatively traps and releases air. Each trap release is one cycle of vibration. This cycle is often referred to as Glottic Cycle and it is divided into phases: opening phase, open phase, closing phase, closed phase. During the closed phase, the air pressure builds up below the vocal fold. When the glottis opens, the air explodes through the vocal folds, and that is the beginning of the sound wave. The strength of that explosion determines the loudness of the sound coming directly from the larynx. So we have this one, closed face, then we have open face, and then we have open face, closing face, we have closed face, then we have here open face, closed face, and here you can see how it works. Look at the diagram. During the closed phase, the air pressure builds up below the vocal folds. When the glottis opens, the air explodes through the vocal fold, and that is the beginning of the sound wave. The strength of that explosion determines the loudness of the sound coming directly from the larynx. First, the laryngeal muscle positions the vocal cord in various degrees of adduction and place them under the appropriate longitudinal tension. Next, muscular and massive forces of exhalation cause the subglottic air pressure to increase. When the subglottic pressure reaches a point where it exceeds muscular opposition, the glottic chink is forced to open. When the vocal cord starts opening from complete closure, they open in posterior to anterior direction, with the posterior portion of the glottis opening first, reaching maximum excursion first, and recontracting each other at the end of the vibratory cycle prior to the anterior portion of the cords. After a release of puff of air, there is a reduction of subglottic pressure and the vocal cord approximate each other again. Myoelastic force of the vocal cord have exceeded the aerodynamic force. The myoelastic force are enhanced because air current flowing through the narrow channel exerts a negative pressure on the channel walls. This is the basic of Bernoulli's principle. The vocal cords are thus sucked back together in an adductic state until the subglottic air pressure can overcome the myoelastic forces of reapproximated cords, and cycle is then repeated. Pitch. The faster the vocal folds vibrate, the higher the pitch. In general, men's vocal folds can vibrate from 90 to 500 Hz and then average about 115 Hz in conversation. Women's vocal folds can vibrate 150 to 1000 Hz and they average about 200 Hz in conversation. Vocal folds vibrate faster as they are pulled longer, thinner, and more taut, and vibrate more slowly when they are shorter, thicker, and floppier. The cricothyroid muscle and thyroarytenoid muscle coordinate with each other to create different patches. You can see in this diagram swallowing. During swallowing, the sphincters of larynx stay contracted, preventing aspiration of food into the air passage. During the pharyngeal stage of swallowing, the larynx is elevated towards the lower jaw. This elevation opens up the cricopharyngeal sphincter, thus facilitating swallowing. The hyoid bone rotates in such a way that the greater cornu becomes horizontal, producing a backward tilting of the epiglottis towards the posterior pharyngeal wall. This movement of the hyoid bone effectively closes the laryngeal inlet. Fixation of the chest. This less known function of the larynx is important for increasing intra-abdominal pressure. Closure of the vocal cords achieves fixation of the chest necessary to raise intra-abdominal pressure required for daily activities like lifting weights, climbing, and even for pressing urine and stools. We have taken this presentation from tinyurl.com. We give full credit to them. This is for educational purposes and we have not uh, put it for any sale or anything, and we give full credit and reference of them. Thank you very much. I am Dr. Parvez. Please like and subscribe my channel. Thank you very much.